guys? All right, so I've been thinking about my cash pay virtual practice, right? So I have a virtual practice which I call digital nomad telemedicine. It's the name is not that important, to be honest with you, these days. I think unless you actually are building up that particular brand for yourself, and that usually comes a little bit later. To me, it's much more important that I have some steady income coming in from people. Now, I am already present on a lot of websites. I'm present on um, Quora, Reddit, and a few other websites. And so, because I have a certain presence, and especially LinkedIn, then people can find me, right? Patients can find me, people can find me. So, in a way, it's easy for them to be like, oh, okay, this guy also does cash pay telemedicine. And eventually, once you can figure out like a better name for yourself and like become more public and just you're known for that in that space, great. Your advertising can go down. You don't have to worry about a lot of things. And as far as like how much money you spend on advertising. For me right now, the most important part, I want to get patients coming in. I want to get that income coming in. And some of the easiest ways for you to get your name out there is to probably look at what other people are already trying to build. There are groups of people who are already building something based around the non-insurance or out-of-network model, right? So the Direct Health Alliance is a very good example. Any kind of health sharing ministry or health sharing service is a good example. If you don't know what that is, they basically pool a lot of money together, and people go and see their specialists and their primary care doctors, or they go to the ER, or they go wherever they go and pay cash. And so this service or this company also will negotiate those bills down. And so they're going to love to know that you, as a physician, are going to offer everything cash. That's great. It doesn't matter how much you charge. You want to charge $200, $300, $100, whatever. In the beginning, I always charge, I still keep my prices low. And the reason I keep my prices low is because I'm still trying to figure out the exact kind of patients that are going to benefit me. And I'm kind of wanting to experiment with some of the telehealth platforms. So I don't want to charge a lot and give that high expectation to the patient and then let them down. So, with that in mind, remember, this is not my career coaching practice. This is not my heart health coaching practice, right? This is my pure, straightforward cash pay primary care and cash pay telemedicine, cash pay urgent care telemedicine. And so that's kind of something that I'm building up. All right, so we have a bunch of tabs here. We're going to go through them one by one. So the first one is Direct Health Alliance. So this is a healthcare solution website. Basically, they link providers with individuals, plan sponsors, they have brokers, and their goal is to kind of get their goal is to basically have everybody come in, pool their money together, and then from that pool they're going to spend and avoid the health insurance model, which obviously, yeah, that's the reason you're listening to me is because of that. So probably one of the easiest way is to just fill out the contact form and get in touch with them and say, hey, how can I work with you guys? How can I list my practice? So here, connect direct with patients, plan sponsors without the fuss. So you can read a little bit more about what it takes. Some of these places are going to charge you money to list yourself on their platform. Some of them are going to be free, but they're going to ask you for certain details. Another good one that I think is worth to have on your radar, and I just thought about it right now, is Sesame. So Sesame is another kind of marketplace where they bring the patient and the providers onto one little platform. They give you all of the services that you need. So you can they'll give you the telemedicine EMR. You can do e-prescribing through one of the common providers, one of the common service providers. And so it's pretty straightforward. And they'll bring the patient for you, so you don't have to go find the patient, which is kind of cool. But you are your own practice. You're not working for them. They're not hiring you. They'll credential you. They'll make sure that you're okay and stuff, but it's not a very complicated credentialing process. And so it's kind of like, here's the doctor, here's you. If you guys want to work together, you can do it on our platform. And I really like that. And I think it's going to take a little bit of time for you to build out your practice, but you can look over here and see some of the providers who've already listed their practice. You can probably look and see why some of these might not be that good, right? Maybe some of their photos are not that great. Their availabilities, like, oh, what could be better? $5 meds, that's really good. Highly rated, that's really good. You can see their prices are somewhere in the $24, $25 range. You can see most of them are non-MDs, non-DOs. So it'd be pretty easy to stand out here and just charge, well, perhaps quite a bit more. Or again, that's something that you'll have to figure out in person. Telehealth visit, here are some in-person visits that you can do, and you can see here 200, 100. And this is, I think, a family medicine doctor, yeah. So pretty cool. And then people can purchase memberships, so they can do a one-time fee or they can do an annual fee, and the physician can still charge whatever they want to charge. So pretty cool. Anyway, going back to direct health care, you can contact them. You can see how you can offer direct primary care. Now, remember, I'm not setting myself up to be a direct primary care. I really just want to be cash-based for each visit. I've considered doing like a annual subscription model, so you pay me annually and I'll be your doctor for the year. I think that could work, but it's one of those things I'm not in a rush to figure out. Guys, remember, you don't have to figure anything out, just make your money. Make some money so that you feel good about it. Okay, so the next one, again, we're just going really broad right now, okay? What you do, what you offer might be very different. So you might be a sports orthopedic surgeon, you might be a dermatologist, you might be an oncologist, and you want to provide some sort of a telemedicine practice. You're going to have to figure out what's best for you, right? So perhaps somewhere where patients hang out to talk about skin cancer, that's maybe where you need to set yourself up. I think AARP does a great job, and advertising on AARP probably will make a lot of sense, or tapping into their network in some way. Maybe writing an article for them would be a great way. You're going to have to figure out what's best for you, but I just want to, again, do the big picture. The big picture for me, AARP, I want them to be on my radar, because I would love to tap into some of their elderly individuals who might either have a high copay with their insurance or have a high insurance or not really understand how the insurance works, so they're like hesitant. And so if I can offer them a cash pay model, that might be really good. If I can be their direct pay primary care physician, I don't want to say direct primary care. If I want to be their subscription-based primary care doctor, that might be really good. I haven't really figured out exactly how to advertise with these guys. I have some hesitations for other reasons, but anyway, AARP, pretty solid, really well known, so I don't think you'll have a lot of problems. There are a lot of other, so one of the ways to research it is to, for example, type in cash pay physicians or cash pay telemedicine. And then all these names come up, right? You're going to see articles that are ranked high by these individual companies, and then reaching out to these companies and say, hey, I really liked your article. I want to get my name in there. Nothing wrong with that. But of course, you have to offer them some sort of value. And I think if your website is not really well built out, you're just not going to be able to. Digital Nomad Health. So for example, if you look at my website right now, it's pretty crappy. Not in the sense that it's horrible. I mean, it's a website, but I list my services and talk a little bit about myself and what telemedicine is and some of the articles I write. Yep, look at this website. I don't even know what happened. Why is this page dead? It is what it is. And the articles that I have here. And the reason I am not investing a lot of effort into, well, this one's actually pretty good. The reason I'm not investing a lot of effort into this one is because this is not where I'm getting my patients. Nobody's visiting this page. It's just a place as a placeholder. I need an about page. I need to list my actual name. I don't have that. That's fine. I'm still getting patients. That's all that matters. But again, it's something that you kind of slowly build up and develop. And that's important, because if you're going to advertise on these kind of places, if you're going to link them to your website, they need to know who you're about. In the meantime, I usually give them my LinkedIn page. Naturally. Okay, so this was a great article, The Rise of Cash Pay Doctors, what they are and how they work. And this was a good explanation of how cash pay doctors work. And then here, it was talking about the health sharing. Great. That's what I'm looking for. So they offer a health sharing service or access, and so it's usually they will have a place where you can list yourself as a provider, and so that's really easy. If not, you can always go to the resources and you can email them, you can contact them and just let them know that you're interested and you want to get your name and your practice there. What gets complicated is some of them are going to ask you to offer very particular ways of offering services to their patients. What I mean by that is they're going to say, hey, we want you to only offer a flat rate of $60. Can you do that? Now, that can get complicated because on your end, the billing, you will have to figure out who's coming in through how many different places. And for that reason, I recommend just picking 5 places that you work with and just keep it simple. In the beginning, it's going to take time. Don't rush to build it out. I found this other article by the Association of American Physicians and Surgeons, and I thought this was really good. A cash-friendly practice to list it. I'll see if I can link all of these in the show description. But I thought that was pretty good because the DPC Frontier Mapper is actually very popular. It's very well known. And so if I search by my zip code, let's see if I come up. I shouldn't come up because I haven't listed myself, but I like how it zooms in like that. Okay, it's over here, right? So here's one. And you can see this is forward, Glendale, accepting new patients, directions, get forward. And then what I always like doing is I like to click on their links. I want to see how do these guys, what does their website look like? How do they advertise? Oh, look at that. I'm right there. I'm listed. This is cool. Accepting new patients. That's my address. This is my website, which is not great. That's my practice phone number. I think that's my fax phone number. And that's who I am. LinkedIn. Open since 2016. I haven't been open since 2016. Maybe. I'm pretty sure I'm the one who listed it, but maybe they found me. Maybe they found it on LinkedIn. Anyway, so yeah, there it is. Primary care, $100. Look at that beautiful, beautiful digital nomad health. I want to change that to digital nomad. Maybe telemedicine, I'm not sure. Mobile Pure DPC. No, I don't do Mobile Pure. Okay, so I gotta work on this. But look at me, I've already done this and I totally forgot about it. So that's wonderful. Forward Health, finally a doctor dedicated to your long-term health. Welcome to healthcare the way it should be. A doctor focused on preventing heart attacks and cancer and not just treating your rash. Wow. Okay, so Forward Health, how it works, member experience, how we're different, our technology, the different type of programs, the doctors that they're there. And again, this could be a place that you can list your practice. I know about Forward Health, and I'm pretty sure they're not the right kind of practice. Wait, is this? I think I might be this guy. Yeah, that's kind of what I thought. It's a private practice for Forward Health, and I think I saw one of their locations in Portland. So I don't know. It's definitely they do a great job with advertising. So if you can get some way somehow in their network, might be worth considering. I don't know enough about them to probably tell you. The other one that I found was the Wedge by Healthcare Freedom. This is another listing for different physicians. I actually remember. I think I tried to list my practice here as well. So let's see. I don't know if I actually did or if I had to pay, and I didn't want to pay initially. I'm not quite sure, but maybe they're more specialists. So it's another good one that I think is worth having on your radar, because they also came up pretty high up on the Google search when I did a search, or I don't know, Google search, but whatever, DuckDuckGo search that I do. And then the Free Market Medical Association. Yeah, this is kind of interesting. Sort of like, how can we avoid health insurance? And they're all about that, right? So this is really cool because it's yet another place where sellers and buyers come together, and your goal is to just list your practice on here. I think it can be tedious. I know it can be tedious to go sit there and do every one of these one by one. The alternative is to just do it and hire somebody to put you on all these different places. And there are people who do that. You can find them on Upwork, you can find them on LinkedIn, who kind of market your practice. The problem is, I think you'll pay a lot of money up front, and maybe you won't be quite as involved, and you won't know where all your leads are coming from. And I think having a little bit of that sense of what the market is like, where people are advertising, where people are finding these services is worthwhile. Medibid was another one that came up, but the website is just so shitty. I don't know. I wouldn't waste time with it. I thought Dr. Marcini did a great job of creating a very simple website for herself. Like, look, this is just a pure, good, simple website. Nothing complicated about it. With 2 or 3 scrolls, I'm at the bottom of the page. The copyright is updated. I have the address. I have direct information. I have direct contact access to her. I can sign up for a blog post. I think that you can get rid of that. You can sign people up as soon as they reach out to you. This is great. I really love that piece. It's kind of cute, like that old school practice style. And the reason I link to this, the reason I put this up is because you want to build out your website as quickly as possible, and it's super simple. You have a menu bar at the top. You have your this is a Google. This is an image. You can create it on Canva, canva.com. This is the phone number. I think if you click on it, you can. If it's your mobile phone, it goes directly to your telephone. And then this is a Facebook. For me, it could be my LinkedIn. And I really like a page like this. I really like a simple page like this because you're gonna bring all of your other. The leads are gonna come into the site. So if the site is just simply you, it's pretty cool. And there's a little bit about her. I thought this was good too. Just a little bit like another photo of her where she went and did her training, what her board certification is. So I thought, yeah, really good website and one that you guys can emulate quite easily. Direct pay is yet another service where, again, they bring out-of-network physicians in with patients, but I believe they also have a kind of a network that they set up. So question is, if you want to be in their network, you can. And I think they had here. Contact us. Yeah. Providing. I can't even read that. Okay. Providing care, Cornerstone. Great. Yeah. Contact us. So I'm going to contact them. So this is the research that I do. And after I'm done with this video and I record it, I'm going to go in and do all of this. Right. This is how I'm going to list my practice. So now we're going to go into a little bit more of the esoteric ways of getting your name out there. For me, one of the most important things is that I find clients who have the same kind of outlook as I do. And for me, people like the nomad capitalists and these other people who talk about being a digital nomad, living abroad, living in other countries. So there's probably a lot of Americans who want to do that, but they still want access to US style healthcare. They want a physician who's trained in the US, who has the same mentality because they've grown up using that same system. If they go to a new system, it's going to be like, they're not going to be accustomed to going somewhere where they're like, no, we're not going to get an MRI. And they're like, what do you mean? I just want to get an MRI. I have the money, I'll pay for it. I just need somebody to order it. So I think in that way, nomad capitalists getting listed, the services that they provide. I think you can chat with these guys and say, hey, why don't we provide some sort of a telemedicine service for your people, like having access to it. Or maybe this guy does a lot of YouTube videos. So I can say, hey, maybe I'll advertise on your YouTube channel. How much would it cost? It probably could cost like $5,000 for sure, because he's got a lot of followers, but might be worth it, right? Might really be worth it. And then I added LinkedIn here because there's a lot of people like Andy. I've talked to him. I think I've chatted with him, and he does a great job of. He basically is CrowdHealth. He's the CEO of CrowdHealth, and so basically it's another health ministry sharing, and so people can go wherever they want to go, and they go back to crowd sharing and get reimbursed. So that would be a great place because I think he has a lot of followers. Yeah, he's got 2,000 followers, pretty good for LinkedIn, and obviously a really good reach with CrowdHealth. I decided to put Charles in here. Charles has a really good, strong platform for people who are sort of against the whole COVID thing, if you know what I mean. Like they're maybe frustrated with the way COVID went, and so he brings on a lot of physicians who are like, yeah, look, the vaccine mandates are ridiculous and that sort of stuff. So I think in that sense, he probably has a really interesting network of people who probably are just a bit more independent minded. I'm not saying that they're going to want ivermectin from you, but they're going to be independent minded. A channel like this with 700,000 subscribers, like Laura Camp, she's a kind of one of the makers, right? Like that maker space of people. But I think it's a good channel to advertise on because the kind of people you're going to get are going to be not complicated, younger, active. They're probably going to be more nomadic, and so for me, this is a good fit. This for the kind of stuff I offer. This is a really good fit. And even though I think she's based out of Germany, obviously the majority of people who are watching her stuff are from the U.S. And so there's different ways of advertising. Of course, you can just do YouTube advertising and have your stuff shown in the little YouTube ad spaces, or I could ask for her to, I could sponsor one of her videos and have her pay for that. And so I think that's another good way. If you are someone who obviously is a little bit more into the functional, integrative, or holistic space, then I think going for somebody like this, like plant-based, these plant-based individuals, if you want to set yourself up to be a plant-based physician, I think that will come across really well. If you are someone who pretty much focuses, all your patients are vegan, or you focus your practice on vegan patients, I think that's a really great platform. And I think it's not, if you watch their videos, they're really good, and I think it'd be worth advertising with someone like this. Or keto, right? If you want to find a carnivore channel, then you can be on their practice. I thought a YouTube channel like this, which is Goldshaw Farm, so they basically are doing mostly off-grid living. There's going to be a lot of people who are off-grid, and they're probably going to want access to a physician. So I think this is another good one to advertise on. And there is Cheap RV Living. These are people who are basically fully nomadic. I mean, these people do not live, anywhere in particular. So I think this is a great one. This is a really good channel to advertise on. And I reached out to Bob, I think his name is. And unfortunately, he said, hey, you have this bad medical history with the state medical board. You had a third-day license suspension, so I don't want to work with you. It's very understandable. So those are the things that you have to kind of navigate. But I can still advertise on his channel. He can't deny that, because YouTube controls his videos, right? Not himself. So in that way, it's kind of cool. And then finally, Vagabond. I think Vagabond, this guy, they pretty much talk about where Americans can go live abroad, and I think that's a really good channel to advertise on. At 88,000, he's not going to make a lot of income, so you can probably get it at a very, very good price. Reddit is another great place. Obviously, a lot of people ask questions on the Reddit Ask Docs forum, which is Ask Docs. So they obviously don't have the money. So with 400,000 subscribers, I think that's another great place to advertise on. So that's it. That's the entire list. I'll try to include these in the description at the bottom of the video, and I will subscribe to these guys. I will sign up with these guys. I will pay these guys, and then I'll kind of share with you guys how that goes. So that's it. If you have any questions, go to my website at digitalnomadphysician.com. The easiest way to contact me always is to just go to the bottom right here. You can see it'll take you here behind this photo right there. It'll take you to my WhatsApp, or if you're interested in getting any coaching with me, you can get some coaching over there. All right, guys, that's it. Take care.